Across the United States, a quiet crisis is unfolding inside our food supply chain. A systematic dismantling of federal oversight by the Trump administration has left key public health agencies depleted, understaffed, and stripped of the tools necessary to detect contamination before it reaches our grocery stores and kitchens. The result is not merely an administrative shift. It's a nationwide compromise of food safety that places the American diet among the most vulnerable and precarious in the developed world. To understand how we arrived at this point, we need to look at the agencies tasked with keeping us safe. The Food and Drug Administration, the Department of Agriculture, and the Centers for Disease Control and Prevention. These institutions have been targeted by Trump and DOGE with sweeping budget cuts and staff reductions. This week, Donald Trump nominated far-right anti-abortion extremist Dr. Heidi Overton, who stood next to the president as he made false claims about vaccines, to be commissioner of the U.S. Food and Drug Administration, replacing Marty Makary, who resigned in May after months of turmoil at the agency. The FDA's Food Safety Division has lost roughly 20% of its workforce. The CDC has seen its staff shrink by a quarter. Specialized teams have been dissolved entirely.
Publix is recalling frozen blueberries sold at stores in Virginia, North Carolina, and several other states. Health officials say 12 confirmed cases of E. coli between May and June are connected to the frozen blueberries. The 10-ounce packages of GreenWise organic IQF blueberries in question were sold on or before July 3rd. They have a lot code of 60401 and a Best By date of February 9th, 2028. Anyone with these blueberries should throw them out or go back to Publix for a refund.
At the CDC, an expert group of 11 scientists dedicated to tracking foodborne parasites was pared down to just 3. Entire advisory committees, composed of leading researchers tasked with advising the government on how to prevent microbial outbreaks, have been disbanded. Collaborative initiatives with international agricultural partners, including joint safety teams working with neighboring nations, have been cancelled. When you remove the scientists, you remove early warning systems. Consider the state of FoodNet, the foodborne diseases active surveillance network. For 3 decades, this vital joint venture between the FDA, the USDA, and state health departments served as a nationwide radar system, actively tracking 8 of the most dangerous foodborne pathogens. Under Trump's directives, that critical surveillance program was gutted. Reporting on major pathogens was made optional, scaling active tracking down to just 2 microbes, Salmonella and E. coli. Pathogens like Cyclospora, a microscopic parasite that causes severe gastrointestinal illness, were simply dropped from required tracking. Administration officials have defended these decisions, characterizing the changes as the elimination of redundant surveillance. But leading public health experts disagree. Dr. Susan Main, who directed the FDA's Center for Food Safety and Applied Nutrition from 2015 through 2023, called the situation a national wake-up call, emphasizing that these were not redundancies, but vital protections that now have been stripped away.
A major expansion in the recall of contaminated lettuce believed to be sickening thousands. Taylor Farms, one of the nation's leading producers of packaged salads, now recalling iceberg lettuce in 27 states, saying the greens sourced from central Mexico may contain Cyclospora, a parasite that causes severe stomach illness. The company saying in part, no other Taylor Fresh Foods products across the country are impacted. No Taylor Farms branded salad kits contain iceberg lettuce. The FDA says Cyclospora was detected in a sample of lettuce that was not part of the company's initial 5-state recall. Walmart is pulling some market-side bagged salads, saying they are working with their suppliers as the Cyclospora investigation continue. And Taco Bell says they worked swiftly to voluntarily remove the product from restaurants and its supply chain nationwide.
The human cost of this deregulative approach is already showing up in our hospitals and grocery stores. Take the recent Class 1 recall of frozen organic blueberries sold across 8 states. A Class 1 designation is the government's highest threat level, reserved for situations where exposure to a product carries reasonable probability of causing serious health consequences or death. The blueberries were found to be contaminated with E. coli 0145, a dangerous toxin-producing bacterium. For vulnerable populations, young children, the elderly, and the immunocompromised, exposure can lead to hemolytic uremic syndrome, a severe form of kidney failure. Thousands of pounds of produce were impacted, pulled from the shelves only after the risk had already entered consumer homes. At the same time, a sweeping cyclospora outbreak linked to imported lettuce from Mexico sickened hundreds of people across dozens of states. Distributed nationwide by major produce suppliers to popular grocery chains and restaurants, the contaminated lettuce caused severe, lingering illness, characterized by debilitating cramps, fever, and dehydration. Cyclospora is spread through fecal contamination, often the result of poor sanitation or contaminated irrigation water at the source. Detecting and stopping such an outbreak requires robust international coordination and intense supply chain tracing. Yet the Trump regime postponed the long-awaited traceability rule, a congressional mandate requiring detailed field-to-shelf digital record-keeping, pushing its implementation back by several years. Without these digital tracebacks, health officials are left searching for a needle in a haystack contamination source, using outdated, slow processes.
The FDA has upgraded an egg recall to Class 1, its highest health risk level due to potential salmonella contamination. The recall is linked to 98 illnesses and 26 hospitalizations in 17 states. Now, this comes after a jalapeno recall this month due to salmonella, and Taylor Farms of Mexico removing its lettuce from stores in July after a multi-state outbreak of cyclospora. I spoke to the Denver Department of Public Health and Environment today. They recommend finding the latest information on food recalls on the FDA as well as our state's health department's website. You can follow their guidelines for disposing and or returning the product and washing your produce under cool running water. Some lawmakers are also pointing to recent federal cuts to the CDC for the uptick in foodborne illness. CDPHE says the federal money that they receive from the FoodNet program to track foodborne disease was cut from $669,000 in 2023 to $496,000 this year, and they're doing fewer case interviews.
The vulnerabilities spill over into the meat industry as well. Recently, tens of thousands of pounds of imported raw beef products were forced into recalls and health alerts after being distributed without undergoing proper federal re-inspection at the border. Elsewhere, contaminated ingredients like jalapeno peppers infected with salmonella made their way into widely distributed prepackaged wraps and meals sold in convenience stores and major supermarkets, triggering multi-state health advisories. When federal oversight retreats, the burden of safety shifts onto the private sector. Farmers and industry coalitions have attempted to fill the void. Groups like the Leafy Greens Marketing Agreement enforce voluntary, highly stringent standards among participating farms, requiring sanitized irrigation water, strict field hygiene, and direct state inspection. But as agricultural leaders themselves acknowledge, voluntary self-regulation can only go so far when produce is grown in open outdoor ecosystems, and it cannot replace a cohesive national regulatory framework. When non-participating or foreign supplies fail to meet those same high standards, the entire food system becomes vulnerable. The consequence is a stark paradox. While Americans pay high prices for convenience foods, prepackaged salads, and imported produce, the fundamental integrity of that food is increasingly fragile. Former top food safety officials now offer warnings that were once unthinkable, advising consumers to avoid basic staple items like pre-bagged salads entirely, simply because a single point of contamination in a processing facility can spread microbes across thousands of packages. Food safety is not a partisan issue. No consumer buys groceries with the expectation that regulatory safeguards have been quietly dismantled behind the scenes. A society's health relies on the basic assurance that its food supply is monitored by adequately funded, scientifically equipped institutions. Restoring that trust requires more than public assurances. It demands reinvesting in our scientists, restoring active disease surveillance, and holding every link in the supply chain to the highest possible standard. until those protections are rebuilt, the nation's food supply remains needlessly at risk. I'm Anthony Davis. You can find me on the 5 Minute News YouTube channel and podcast, on Wednesdays co-hosting Uncovered, on Global AF, on Legal AF, and on Sundays on The Weekend Show with MeidasTouch.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.